Hello again. Now, on today's Health Focus, we are looking at infertility. This is a topic that many people shy away from because, believe it or not, yes, there's still a lot of stigma attached to it. Experts warn that infertility isn't just a woman or just a man's problem. Both partners can contribute. Well, Dr. Antonio Rodrigues from the Medfem Fertility Clinic talks to us now about just his experience with couples, with individuals. Dr. Rodrigues, a very good morning. Thanks so much for your time. I suppose let's just define, firstly, what is infertility?
Yes, so the definition is that if a couple have had unprotected intercourse for a period of time and, they take the definition academically says a year for those that are under 35 and for people over 35, 6 months because you don't want to be waiting. Having said that, just to put it in there, if someone has already got gynecological problems like they don't have menstruation or they've got a history of infertility or if the male knows he's got a problem, then it's no point in waiting. Then you must go and see a doctor as soon as you start trying. But that's in broad principles the definition.
All right. Well, I suppose if we were to ask for signs or symptoms, it would be if somebody's been trying, like you say, within the space of a year, having unprotected sex and still nothing is happening. That would be, I suppose, the confirmation. But are there any other signs or symptoms earlier on that you can tell from that this is going to be a problem?
Absolutely. So on the female side, the two common conditions that we see is polycystic ovarian syndrome, where they have irregular cycles, they have problems with skin, and often those ladies have had those problems. They've seen gynecologists before. They might have been put on a pill at a younger age to control that. So there's no point in waiting to manage those patients. It's best to see them early, get them managed quickly, and often they'll fall pregnant quickly if you do it that way. There's a lot of women who are diagnosed with endometriosis prior to trying to fall pregnant. They're also at a higher risk. Some patients might be aware that they might have had pelvic infections at a younger age. They could be at risk. On the male side, often you don't know on the male side unless there's been some specific problem such as the testes didn't descend at birth or that there were some problems with infections in the testes. Generally in a male, you have to do a sperm test before you know whether there's a problem or not. So men don't often know until you do that sperm test.
So where do you start? If a couple comes to you, Doc, and they say, this is a problem, we've been trying for so long, nothing's happened yet, do you start with the woman in the relationship first? Or both?
No.
How does that work?
At a fertility clinic, there's the guys, we don't do it that way. So the principle of it, you've got a couple, you test both. From the beginning, it is no use focusing on one or the other. It's just a waste of time, especially when 6 months later, a year later, you find out you've been focusing, let's say, on the lady, which is often the case, and then you find you've got a major male factor problem. So in our particular practice and in any fertility practice, you cannot do one or the other. We do both. So we test the male. That's a relatively easy test. They have a sperm test, a semen analysis. They have to produce a sample. So for some men, that is psychologically difficult, but they have to produce a sample by masturbation. There are a few other ways of getting samples, and that sperm is analyzed in our laboratory, and we measure the count, the way, how many sperm there are, whether they're moving properly, whether they're normal, whether they have normal DNA. We look for infections, and in our particular practice, we always look at a hormonal profile in the men because they also have hormonal problems. So that's right up front, Uveka. We do that. It's not, and guys have to understand that out there. We got it. It's a team effort. So we need to have the males on board, and we then focus obviously on the female side. We again do a hormonal profile, a full complement that looks at the hormones, including thyroid, insulin, prolactin levels. We check then that female to see if she's ovulating. We do that by ultrasound. We have a look at the anatomy with the ultrasound. We make sure there's no unusual things like fibroids in the uterus. And this is quite quick. So patients do this preliminary blood tests. The guy does his analysis. They come for their first assessment with all that knowledge. We do a scan on the woman on the day, and really by the end of that consultation, we have a very good idea where we're at with this couple. There then might be a few extra tests that need to be done, but it's right up front. We like to have a full complement of tests, and the reason I'm mentioning that is because if you don't look at all the factors that can cause it, you could have someone who's got let's say, a polycystic ovaries, and if you don't focus on the other hormones and you don't check for the whole lot, you're trying to fix one thing and you haven't fixed the whole lot. And these things are complementary. Most patients have multiple factors, as you mentioned in the intro. Male-female factors, we see that in our particular practice 50% of the time, that you have a dual factor problem. Well, so you need to look at the total picture.
Well, Doc, you mentioned yes, certain conditions like polycystic endometriosis, all of that when it comes to women. Are you able often to pinpoint the cause of infertility? I mean, are there certain things like, I remember hearing once that if a man has mumps, it could render him sterile, later on in life as an adult, things like that. Are there other causes? Is it lifestyle as well? We can even go as far as to say, cycling shorts could cause this, all those stories that you hear. So just help us out there with the causes or common causes. Right, we seem to have a bit of a technological gremlin in the pipeline here. We'll try and fix that and get back to Dr. Rodrigues with that. But we are talking infertility. We are talking different types of infertility. We are talking that it's not just a woman problem. It can be a woman and a man problem. And we still have to get on to treatment as well. That's what we're talking to Dr. Rodrigues about. We'll continue that discussion in just a moment.